You're listening to Soundside. I'm Libby Denkman. Local and national organizations alike are still absorbing the historic implications of the Republican tax and spending law known as the One Big Beautiful Bill. President Trump signed the 900-page piece of legislation on July 4th. The law makes the Trump tax cuts of 2017 permanent and increases spending on border security and energy production, among many other measures. It also includes significant cuts to government assistance programs like SNAP and Medicaid. So how will all of this affect people in Washington state? We reached out to several local leaders about how the One Big Beautiful Bill will affect their work. Here's one.
I'm Gloria Hatcher-Mays, Executive Director of the Rainier Valley Food Bank. For us, the budget proposals in the awful bill that was signed by the president are like a direct line of attack on our community.
Hatcher-Mays points to the stricter work requirements for beneficiaries to qualify.
The change in how SNAP, the Supplemental Nutrition and Assistance Program that used to be known as food stamps, the way that those benefits are now going to be distributed hurts the working poor, removes people from accessing these benefits, and punishes people with paperwork who do qualify, but can't keep up with the need to continuously prove they do qualify.
State officials say the new requirements will apply to more than 130,000 people in Washington. Just when these work requirements come into effect is still unclear. The law also includes a massive surge in funding to support the president's goals around immigration enforcement. An estimated 200,000 homes in Washington state have at least one member without legal status. Immigration and Customs Enforcement alone will receive $75 billion in extra funding over the next 4 years in order to support President Trump's mass deportations campaign. All of this is making local immigrant advocacy organizations even more concerned.
I am Malou Chávez, Executive Director of Northwest Immigrant Rights Project. The passage of the tax and spending bill is devastating for our communities across various sectors, and it alters U.S. immigration policy in ways we had not seen for close to 3 decades. There is already so much fear and suffering in our communities. We are witnessing the separation of families, people being taken away from their loved ones to be detained in immigration custody. And the immigration jail in Tacoma is at capacity. Our communities are being torn apart.
Immigration arrests in Washington state have increased 65% since Trump took office. That's compared with all of 2024, according to reporting last month in the New York Times. Chávez notes that one part of the law is already impacting the communities they work with.
It also establishes a new application fee schedule across immigration processes, which went into effect immediately, creating new financial barriers for people seeking humanitarian protections. Someone, for example, who is seeking asylum, temporary protected status, or applying for an initial work authorization is now required to pay high fees that are unaffordable for many, and there are no available fee waivers for these applications.
Meanwhile, Democratic leaders at the local and national level almost universally oppose the Big Beautiful Bill. Here's what Governor Bob Ferguson told Soundside.
On so many levels, it's, just possibly the worst piece of legislation I've seen in 20 years in politics. As a state, it's going to be a challenge for us.
Ferguson had already announced last week that the state would provide millions of additional funding for Planned Parenthood if necessary. That's because the Big Beautiful Bill includes a 1-year moratorium on Medicaid funding for Planned Parenthood, which took effect immediately, though a judge has temporarily frozen that moratorium. But Ferguson says there are still far more funding challenges ahead as a result of the law.
We do not have billions of dollars lying around to backfill these cuts. And so it's going to do a lot of harm to Washingtonians. Obviously, we're working through the implications, gathering information, and more to come on that. But it's going to result in a lot of harm to a lot of people, unfortunately.
When it comes to health care, there are a slew of cuts that are likely to impact hospitals and providers, especially those serving rural areas. The massive spending package will slash Medicaid by around $1 trillion over the next decade. A lot of health centers in the state rely on revenue from Medicaid. Governor Ferguson says that dozens of rural hospitals in Washington are at risk of losing services or closing completely. To better understand how these cuts could be felt, we reached out to Jacqueline Barton True. She's the Vice President of Advocacy and Rural Health for the Washington State Hospital Association. Jacqueline, thank you for being here.
Thank you so much for having me today.
So I'm sure that while the back and forth between the House version, then the Senate version, and then the House version again was going on, it was kind of tough to nail down precisely what this bill would mean for hospitals. Now that it is passed, what does the funding picture look like? How much do hospitals in Washington stand to lose?
The picture's bleak. The projections kind of vary, but when we look at just direct cuts to Medicaid payments to hospitals, over the next 10 years, we're looking at $6.2 billion in cuts, and that's just to direct payments that is going to come to this state alone. Then on top of it, you have the projections. I think the governor's office said this week they're looking at 250,000 Washingtonians losing health coverage. I think that's maybe a little conservative, but even with 250,000, that's not only a huge impact on those patients individually, but that has a big impact on the back end financially for hospitals as well, because now those folks, just because they lost coverage, they're still going to have heart attacks. They're still going to get in car accidents. They're still going to need hospital care. And when they come to the hospital, that care will be uncompensated. And hospitals will still provide that care, but they won't be getting those Medicaid payments or commercial payments that they might have otherwise. So that 6.2 billion is just the start of the cuts. And then we expect to see many more as the full impacts of this bill really come into play.
Republicans who voted for this argued that this is about adding work requirements for able-bodied people on Medicaid and tackling fraud, that this was not going to go against the president's promise of, not touching these social safety net programs. How does that argument land with you?
Ultimately, we know that Washingtonians will lose health care as a result of this bill and access to health insurance. For hospitals, our mission, our legal requirement is to provide care to whoever comes through our doors. So from our perspective, whether or not someone is working, whether or not someone is a citizen, whether or not someone, you could put any kind of qualifier there, we're going to care for patients who come through our doors. And so what we care about is folks having the best access to care possible. And fundamentally, this bill undermines our ability to provide that access to individuals across Washington.
For folks who are not on Medicaid, how could this potentially affect them? I mean, when we talk about the impacts to hospital services, what does it mean for the broader population of our state?
Yeah, thank you so much for that question. Bottom line here, every Washingtonian is going to feel the impacts of this bill. When hospitals are cut, whether it's cut by the state, cut by the feds, whether it's cut, one type of payment or another, those cuts translate eventually into cuts in services. And so even if you are not on Medicaid, you still need to access services from time to time. Your family members need to access services from time to time. And as hospitals work to absorb these giant cuts, these billions of dollars in cuts, that will fundamentally means at some point services will have to be curtailed. And that might mean longer wait times. It might mean traveling farther to reach specialists. It might, in the worst case scenario, unfortunately mean closed hospitals, particularly in our rural areas, which will really devastate those communities. So, and ultimately, as I said, folks, even without health insurance, they still need health care. And that cost has to be paid for by someone. So it drives up costs across the system, not just within Medicaid. So while this is a bill that's supposed to be targeting Medicaid, the cost of this will be borne by all of Washington.
So in just a minute, we're going to talk to Astria Toppenish Hospital, which is a rural hospital that is looking at the effects of what this bill might mean for services and for their continued operation. In a more general sense, do you have specific areas of the state or specific types of healthcare centers of hospitals that you are particularly concerned about right now?
Well, absolutely. A lot of attention is being paid to our rural hospitals, and it should be. Our rural hospitals by and large, are typically more fragile from a financial perspective. It's just challenging to deliver healthcare in an area where there's less volume, less patients coming through your door. And those tend to be concentrated, I should say, in central and eastern Washington. There's certainly a handful there that I'm very worried about how they're going to continue to deliver the services they deliver to their community today. That said, these cuts are devastating for all hospitals. It's not just rural hospitals who are going to feel this pinch. It is hospitals in downtown Seattle and Tacoma, all up and down the I-5 corridor in Spokane. The hurt of this bill is going to be felt all across the state.
There's an interesting timing element to this because the tax cut part of the big, beautiful bill, that takes effect right away, like in 2025 and 2026. The Medicaid cuts are delayed. They are set to begin in 2027, so after the midterm elections. What does that mean for hospitals? Does that mean that, you have some time to look and backfill that funding?
It does give us some time, and we're hopeful that it means that we can, pursue some creative strategies to try to minimize the impact. But ultimately, I don't know where we go to find $6.2 billion. These cuts are going to have an impact, and I don't see an immediate way, even with the 2 years delay in implementation. I don't know how we would backfill that amount of money. And so, yes, I'm glad they're not starting in 2026, but waiting till 2028 doesn't help me sleep at night.
What kind of either adaption plans, maybe like mergers, big kind of closures, like is there big stuff on the horizon here that's being talked about?
Yeah, and I want to stress that those are really community by community decisions. But yes, I think all of that's on the table. And again, it's hard to overstate the magnitude here. These are really huge cuts. And so hospitals are going to have to get creative. They're going to have to make really hard choices. One of the real challenges here is that these cuts are coming at a time where hospitals didn't start in a great position. We lost about $4 billion over the course of the pandemic. That has really undermined our ability to make capital investments, to grow, to do the things that many hospitals need to do to serve their community. But what that also means is that a lot of those perhaps easier, none of these are easy decisions, but some of the things you would do to consolidate or to try to save costs, that sort of thing, were really done at that time to deal with those huge losses that were coming then. In 2025, we started to sort of crawl back out of that hole a little bit. We were able to work with the legislature to actually pass an increase in Medicaid funding that started to flow in 2025 and in 2024 and 2025 really started to help our hospitals. But now we're just looking at that getting so much worse with these new cuts coming down and being so much worse than what we saw during the pandemic. And so hospitals are going to have to get creative, but there's no easy solutions here. And I think that we're going to see, at a minimum, closures of services. And I worry very much that we will also see hospitals close.
Are there any other impacts we haven't discussed yet that you think people should know about?
I just want to center that these are real people we're talking about. When you lose your access to healthcare, that's a huge impact for you, for your family, for your ability to work, for your ability to participate in the community. And so, yes, this is a real huge impact on hospitals, but hospitals are a part of communities, and this is going to be a big impact for all Washingtonians. And hospitals will be doing their best to get creative with that. It is our mission to serve our communities. We're going to continue to do that, but it's going to be very challenging.
Jacqueline Barton True is Vice President of Advocacy and Rural Health with the Washington State Hospital Association. Thank you so much.
No, thank you.
And we want to get a sense of how the cuts are going to be felt on the ground. So now I'm turning to Kathy Bambrick. She's the administrator for Astria Toppenish Hospital, which is in central Washington. Before we get into the bill, can you just sort of paint us a picture of Astria Toppenish Hospital? Where is it? What is the community that you serve primarily?
The Astria Toppenish Hospital is located in central Washington, and it's the only hospital in the state of Washington located on the Indian Reservation. We serve, we serve the Yakama Nation tribal members. We also serve migrant farm members who live and work in the area. And we also serve the surrounding communities. Hopenish has the rare distinction of having now the second highest Medicaid rates in the state of Washington. And then combined about 72% Medicaid, Medicare. We have, I always say, just like a little bit of insured patients, but not very many. And then the rest is charity care.
Before this whole bill started to be debated, I'm assuming it's not easy to operate a hospital in, the area that you operate in a relatively rural area with a high number of Medicaid recipients. What were some of the financial obstacles that you faced as a hospital before this bill passed?
Sure. We're one of the only rural hospitals in the state that does not get paid for the cost of its services. So when you compare us to other rural hospitals that surround us, there's 5 small hospitals that surround us. They all get paid cost. So the cost for providing Medicaid and Medicare, we get 70% of the cost. So we get 30% less for every patient we see. So we just have been fighting to get paid the same way other rural hospitals get paid. So that's been sort of our advocacy work for the last 3.5, 4 years since I've been here. And then they've been fighting since before I was the administrator of the hospital. But it's called the Critical Access Hospital Designation. And you have to be qualified at the federal level, and the state has to agree and push up an application because it's a combination of both federal and state funding. And we've been fighting for that. We did make some progress in the state, but with the big, beautiful bill and all the cuts to Medicaid, it's set us back even further. One of the other things that we've been working on is we've been expanding our behavioral health services. We had a path to financial viability by the end of 2026. And with the passing of the big, beautiful bill, that opportunity is gone.
You were laying out these financial difficulties that the hospital already had. Now that the bill has been signed, what are the effects specifically that you're expecting from the BBB on Astria Toppenish?
Well, obviously, we've spent most of our time advocating against the big, beautiful bill. We've made sure Congress and our members of the congressional delegation knew the impact. And I can tell you, they knew when they passed this, it would have an impact, particularly on Toppenish Hospital, because again, we're paid differently. So we are just working extremely hard to advocate for healthcare within the community and a fix to the Medicaid situation and reimbursement. Quite honestly, Congress created this problem for us. We want Congress to fix it. So we're working really hard to turn that around. And as you can tell, we're being very vocal about it, about the need.
Yeah. I mean, people can hear, for example, we're expecting this many, thousands of people in Washington state, millions of people nationwide to lose care. But for a rural hospital, what specifically does it mean for you? I mean, if somebody comes into your doors, I imagine it matters whether or not they have Medicaid, right? Whether or not they're insured at all. I mean, what are you expecting in terms of how many people you're going to start to see that are uninsured?
So we're still quantifying it. I was trying to get a kind of a ceiling and a floor on me because it's really hard to come up with the full impact. But when you're already operating at a negative margin, the $1 trillion worth of cuts in Medicaid is going to affect us, right? So we already know that this isn't going to be good for our operations. But I tried to describe it for people so they really understand how this is going to affect everyone. So as a hospital, and it's our mission to serve everyone who comes through our doors, but people don't realize there's a federal law that requires us to serve everybody who comes to our doors. So it's called INFALA, and it actually extends out 250 yards around the hospital, that anyone who presents, we have to provide a medical screening exam. So that means everybody who comes to the door, we have to serve, even though, we're not going to get paid. So if less people have Medicaid that come to our doors, that's going to be more charity care for us. So what that means is we're going to get paid less for providing the same service. And so hospitals across the nation, all of us, have to look at the services we provide and say, what are those services we're providing for our communities that they need, that we lose money on? And those are the things that we are looking at to cut. We're not cutting for Medicaid patients, we're cutting for everyone. I've heard other healthcare leaders say healthcare is going to become more expensive. And I just think, I don't think that's the story that we need to tell. Healthcare is going to become harder to get to for everyone, right? We're all going to lose services.
So what happens over the next couple of years? Because we know the Medicaid cuts have a bit of a delay before they kick in. Is there conversations happening at the state level in any other places about where to bridge this gap of who will be left without Medicaid care and coverage, and what happens to the rural hospitals? Like, are there other sources of potential help here?
Well, I believe so. We're working tirelessly on this issue, just like we did advocating against the Big Beautiful Bill. I think we're all still in shock that it was passed into law. But I know that we're all going to keep fighting. I'm going to keep fighting for the citizens of the Toppenish area. You know, these are families, farm workers, you know, senior citizens, children who deserve access to care. And I think across Washington State, we all agree. Our state is having some financial concerns as well. They don't have a balanced budget, so we're all really struggling to prioritize what's most important. But I can tell you, I can feel that everybody's still fighting.
Kathy, I want to ask a question I also threw to Jacqueline Barton True with the Washington State Hospital Association, which is the Republicans who passed this legislation said they were dedicated to protecting health care for people who need it, but that this legislation would specifically improve the waste, fraud, and abuse that they say is rampant in Medicaid. And they argue that this would make more people have to, you know, be working basically when they get Medicaid. Do you have any response to that? Like, is the issue of people not working and just sort of taking Medicaid and kind of, you know, leaning on the government dole, is that a big problem in your area from the people that you serve, that you've observed?
The people who live in Yakima County and the top of this community are hardworking, good citizens. We don't see the waste, fraud, and abuse. What I believe is they've made it harder to be on Medicaid, and so people are going to lose their Medicaid just by the new paperwork and all the requirements that have been put into place for people to keep Medicaid. So it just made it really hard for folks, just more difficult. But unfortunately, again, all the burden falls on, in this instance, the hospitals. I mean, it's healthcare in general, but on our discussions about hospitals. And we have to see everybody who comes through our doors. We want to, again, it is our mission. But again, that burden falls on us.
Is there a scenario in which Astrea Toppenish Hospital would have to close because of these cuts?
Well, I think we have all options on the table. I mean, we've been hearing about the Rural Health Stabilization Fund. That's something that we've heard from our congressional delegation is a fix. But, you know, the Big Beautiful Bill, the $100 billion a year in cuts, right? And then the Rural Health Stabilization Fund is $10 billion a year, you know, just looking at it annually. It's like they took $1 from us and they gave us back 10 cents. You know, I'm grateful. I'm never going to say I'm ungrateful for the funds, but what we really need is a fix to healthcare, the whole healthcare system. And we have to have a fundamental belief that Americans all deserve healthcare. That's the fundamental right of being an American. And I just don't think that we agree on that.
Kathy Bambrick, Administrator for Astrea Toppenish Hospital, thank you.
Thank you.
Thanks for listening to Soundside. This show is only possible because listeners support us. If you're able to give right now, please check out the show notes for a link to donate. And don't forget, you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m., Monday through Thursday, or anytime online at KUOW.org.